Hey hikers, it's Lee with Trailside Fitness. Today, we're going to talk about the meniscus. The purpose of the video today is to help educate you on the anatomy and the function of the meniscus, how it's commonly injured, and some exercises that you can use to help strengthen your knee. This video is not intended to diagnose or treat any issue you may have with your meniscus. It's purely educational. So first things first, let's talk about the anatomy of the meniscus. The meniscus lives between your two leg bones, your femur, which is your upper leg bone, and your tibia, which is your lower leg bone. It basically acts as a shock absorber between the two bones. It's kind of wedge shape on the outside and it tapers inward as it moves toward the middle of the joint. This helps to ensure that the joint spaces fit together nice and snug. And as the joint surfaces move, so as you're bending or straightening your knee, it actually moves that meniscus forward or backward to increase the surface area between the joint surfaces. This also aids in nutrition and hydration for the joint, which keeps it nice and healthy. The meniscus is a C-shaped design, and there's one on either side of your lower leg bone. The middle one is a little bit larger than the one on the outside. And this inside one is also the one that's most commonly injured, especially for hikers. The meniscus itself is made of fibrocartilage, which is kind of a rubbery substance, and it's got a bunch of crisscross overlapping layers of fibers that give the meniscus a lot of strength. The meniscus also shares some common connections with the MCL, which is the medial collateral ligament. It runs along the inside edge of your knee, as well as the anterior cruciate ligament, or ACL, which is inside of the knee. The hamstrings attach to the back of the meniscus and help to glide it backward, and the quads have some influence over moving the meniscus forward when you straighten your knee. So we're also going to take a look at the meniscus itself in terms of blood flow and innervation, or how much nerve fiber is there. On the outer third of the meniscus, the red portion here, tends to be more vascularized, so there's more blood flow, and there's a little bit more nerve tissue there than anywhere else in the meniscus. This means an injury to this outside area tends to be a little more painful, and that it's got a better chance of healing than anything on the inside. As you move progressively inward on the meniscus, you lose the blood flow and you lose the nerve tissue. So let's take a look at some common injuries to the meniscus. Generally speaking, an injury to the meniscus happens when there's been some sort of twisting or rotational force through the knee. This can be non-contact, so like a sports injury. Maybe you plant your foot and then go to turn and change directions. Or it can be contact-driven, so you've actually had some direct trauma to the knee itself. For hikers, it tends to be non-traumatic, so there's no outside event, nothing hitting you. But it tends to happen when the foot is stationary. So if you post hole, for example, and your foot is stuck in the hole, your upper leg bone rotates over top of that meniscus. That creates a compression and a shear force on the back side of the meniscus that most often leads to a tear, which is going to be in this, we call it the posterior medial side, or the back middle of the meniscus. A traumatic tear to the meniscus generally happens between ages 10 and 40. After age 40, there's usually a degenerative component to a meniscal injury. As I mentioned earlier, the meniscus does have some connections to the muscle groups and some of the ligaments that support the knee. If an injury does occur to the meniscus, it's important to note that you may have an MCL or an ACL injury as well. Looking back at our top-down view of the meniscus, these zones play a factor when it comes to injury. If you have an injury in zone 1 or zone 2, it's repairable. If there's an injury in zone 3, it's generally non-repairable. What this means is that the blood flow really affects how that tissue is able to heal with surgery or maybe without. Zone 1 has a lot of blood supply and has the ability to heal. Zone 2 has limited blood supply and may not have enough to actually support the healing process. Zone 3 has none, and therefore any injury that happens will not heal without some sort of surgical intervention. Taking a look at some of the most common tears, the bucket handle tear is one of the more common ones and typically occurs with the scenario I laid out. So So if your foot is stable and you have a rotational force over top of your knee from your long leg bone, that will cause a bucket tear scenario. Two other common tears that we see are the parrot beak tear. You'll notice that this one is in that third zone, or that zone with very little blood supply. This is typically one that is non-repairable, and they'll just go in and trim out the edges and make it a little smoother. The third type we see is a longitudinal tear. This one tends to be in zone 1 or zone 2, similar to the bucket handle, but the direction of the tear is different. So instead of going around the whole backside like a bucket handle, it covers just a portion of it. If you have sustained an injury to the meniscus, generally there will be pain and swelling around the knee. The pain that you're going to feel will be localized to the area of injury, meaning you're not going to feel it on the opposite side of your knee or in the kneecap. It'll be right where you sustained the tear. Depending on the type and location of your tear, the knee may not be able to extend or bend fully. That's a good indication that you've got a meniscus tear and you need to go in and see a doctor. So moving on to injury prevention. I've had a couple of questions regarding the meniscus and how you can help to protect it. The best bracing we have is muscle. So building up the quads, the hamstrings, and the calf muscles, which all surround the knee, help to provide the knee with a large amount of stability. If you have a brace on, it may give you a sense of security, but there's absolutely zero effect of that brace protecting the knee from a twisting force like you'd see with the meniscus injury. The meniscus isn't one of those structures that we can really strengthen with exercise. What we can do is support the knee joint by making sure we've got strong glute muscles, quads, hamstrings, and calves. To that end, I look to squats, deadlifts, lateral step downs, walking, lunges, anything to get some strength in all those muscle groups. I also like cycling and rowing as good options, just to make sure that the knee is moving well and those joint surfaces are getting lubricated. An injury to the meniscus is something you can completely recover from. That being said, due to the nature of injuries that can happen, like other structures being involved, or the different types of tears, as well as any degenerative changes in the joint itself, it's extremely difficult to give you a specific protocol or program to follow if you do have a meniscus injury. If you elect surgery, your surgeon will have a protocol that will outline a set of weeks and what exercises can be done in those weeks. Together with your physical therapist, they'll make sure they guide your exercises safely to get you back to your sport. It's important to note that after surgery, if you elect to have one, you're going to feel much better coming out. The scars are going to be small and they're going to heal quickly, which may lead you to believe that the meniscus is completely healed and ready to go. The reality is it takes a lot of time. If we just look at the blood flow and the nerve tissue to the meniscus, it's pretty limited. You're not going to get a lot of internal feedback as to how that tissue is actually responding versus like a hamstring strain or a quad strain, which gives you a little bit more internal feedback. My best advice to you is to follow the protocol, listen to your physical therapist, and you guys together can make the right decisions to get you back to hiking. So I hope this video was informative. We did cover some anatomy, common ways the meniscus is injured, and some ways you can help to strengthen the knee itself. If you have any questions, please feel free to reach out and I'll be happy to help you in any way that I can. Happy trails.